Cystic fibrosis is considered an orphan disease, which is defined as a condition that affects less than 200,000 people nationwide. There are about 30,000 people living in the U.S. with cystic fibrosis. The main problem with orphan diseases is that pharmaceutical companies lack the financial motivation to provide life-saving drugs to the patients affected by these diseases. Kalydeco was the first FDA-approved medicine to treat the molecular cause of cystic fibrosis. Since 2012, when ivacaftor was first approved, Vertex Pharmaceuticals has enjoyed a near monopoly on first-line cystic fibrosis drugs aimed at treating the underlying mutations in the CFTR gene. Kalydeco costs approximately $311,000 per patient per year. Orkambi, which is generally less effective but treats more cystic fibrosis patients, costs $272,000 annually. The high cost of Kalydeco and similar drugs has been an issue for those attempting to afford the treatment on Medicaid. In 2015, 3 patients created a federal lawsuit against the state of Arkansas for refusing to pay for the drug. As a result, the state must now prove why they will not pay for the drug, and the patient only has to show improvement in one area to prove the individual benefit from it. Vertex Pharmaceuticals aim to produce one drug that can be prescribed to the majority of patients, rather than the current prescribing regimen. The faces of cystic fibrosis. The most tragic aspect of cystic fibrosis and its high costs of treatment are those who cannot afford the millions of dollars in treatment it costs to continue living a healthy life with cystic fibrosis. These are the faces of those who cannot afford treatment of the disease. Tyla, who is now 13 years old, lives in New Zealand, where these life-saving drugs are still awaiting approval for payment assistance. Maddie, who was 13 at the time this photo was taken, lives in Canada, and her family struggled to pay for Kalydeco, which cost them $349,000 a year.
Downside to the medication, although it works incredibly well, it corrects the defective gene in my body. It comes at a cost, which is $348,000 a year. It was not covered by anything, so my family was paying for it out of their pocket, so that was very difficult on all of us. But what I had to do, and I knew I had to do it because there were other people that needed the medication, I started fighting for it and faced the government to get it covered because I knew people needed it and people were dying because they didn't have this medication.
Maddie's story has a happy ending. Her push to get Kalydeco covered in Canada was successful, and her medication is now covered. It is important to continue the fight to get medications for CF and other orphan diseases covered by health insurance, despite their relatively rare occurrences. Several foundations are working to lower the cost of drugs to treat orphan diseases like cystic fibrosis, but it is also important to note that government restrictions on healthcare are the major roadblocks to helping cystic fibrosis patients get the treatment they need. The Cystic Fibrosis Foundation is working on ways to encourage the development of new drugs and find ways to lower the cost or improve government assistance for existing drugs.